called wet bulb thermometer. What is that? That I've never heard of.
So at training camp, we have to, or at all mass events, we have to decide what is the temperature. And so we look, at the weather, website or on our phone. It tells you the temperature, and then sometimes we also use the feels like temperature. So we have something a little bit more precise. So it takes account the sun, your altitude, the humidity, the wind speed, and the actual ambient temperature. And it comes up with a much more accurate number as to what the athletes are feeling right now at that spot. And we use that as a gauge to whether they can safely continue. So we have a chart almost like the urine chart, but it's more like a traffic light. We have a green, we have a yellow, we have a red, and there's also a black. And so specifically for football, if we're in the red or black, we either change the timing or we go into that bubble that you talked about to keep the players safe so practice can continue, but we don't hurt anybody.
Safety comes first.
Safety comes first.
Caffeine before working out, what do you think? I tended to get a little cafecito, real quick. Look at Dr. Swartzen laughing at me, like if I need it, right? But I tend to get a little cafecito shot before I go running.
I don't typically advise it. You'll see some guys try to take pre-workouts before. I have taken some pre-workouts. Sometimes I just need it to get through.
You too.
Yeah, but it's not advisable because it does speed up the heart rate and you can get lightheaded. There's a lot of side effects, so you just got to be careful.
Be careful. All right. How about you, Dr. Swartzen?
I think caffeine is a wonderful thing that we all use. Physicians and non-physicians use caffeine all the time. I think the judicious use of caffeine is what's important, not trying to drink one of those
Coladas.
Well, yeah, and there's also the commercial products that have a tremendous dose of caffeine.
Oh, yes.
So instead of, taking the entire thing, take a little bit what you need, see how your body reacts. Again, experiment in a safe way.
Exactly.